Dysphagia is a swallowing problem that can occur after a traumatic or an acquired brain injury. Speech-language pathologists are typically the rehab professionals involved in the treatment and management of the swallowing problems. When we go to swallow or move food through our mouth and down to our stomach, there are three phases. There's the oral preparatory phase. This is where our lips close and keep the food in our mouth. There's the oral transit phase, where the food is now moving towards the back of our mouth, towards our pharynx or our throat. And that's the final phase of the swallow, when the food drops into the throat or the pharynx. After a brain injury, there can be a breakdown in any of these three parts of the swallow. This is not ideal because it can lead to choking, or it can lead to food going the wrong way and a pneumonia. So as speech pathologists, we like to have treatment techniques that we can use to help ameliorate any of these three conditions. And this is the device we're going to talk to you about today.
Here at Parkwood Institute, the speech-language pathologists have implemented the use of a new oral exerciser produced locally here in London, Ontario. It is called the Abilex. It is a medical-grade silicone device that is used to help patients who are experiencing facial weakness of the tongue and lips and who are experiencing challenges with swallowing and speech. The purpose of the oral exerciser is to complete 4 basic exercises that assist with tongue strengthening and lip strengthening. The first exercise is called bulb side to side. The exerciser is put into the patient's mouth and they use their tongue to move the bulb side to side. The next exercise, the bulb is placed in the patient's mouth and the patient is asked to purse their lips around the bulb, and the clinician pulls on the exerciser to improve lip strength. The third exercise is called the tongue push-up, whereby the bulb is placed into the oral cavity and the patient uses their tongue to push the bulb up to the roof of the mouth. And the final exercise is called bulb forward to back, whereby, again, the exerciser is placed in the mouth, the patient uses their tongue to move the bulb from the front of the mouth to the back. These exercises target all muscles of the tongue and the lips. They are done twice daily with the patient in their speech therapy sessions, and the goal is to improve lip and tongue strength to improve swallowing and clarity of speech.